So let's talk about another uncommon and possibly deadly diagnosis that I had recently that often gets misdiagnosed as something that's much more common in pediatrics. So I had a 7-week-old who recently came into the emergency room with a cough and trouble breathing, was having retractions, using accessory muscles. These are all signs of respiratory distress. In the emergency room, they tested him for several viruses and he came back positive for a very common virus. All signs were pointing towards the diagnosis of bronchiolitis. This is a super common diagnosis. We see hundreds of them every year. When he came up to me to the pediatric floor, he actually did look like a typical bronchiolitis case. Looking back at his chart, I saw that somebody decided to do a chest x-ray, and when I took a closer look, he looked like he had a little bit of a larger heart than usual. So I went to get a little bit more history from Mom, and something made me a little bit concerned for a different diagnosis. So I checked what we call a BNP level, and it was extremely elevated. This kid was in heart failure. He did not have bronchiolitis. This is extremely uncommon in infants. Like and follow for part 2 to see what caused this.